Hi, everybody. My name is Dr. Kelsey, and you are currently watching KML Academy, where we are always anchored in science, guided by intuition, and personalized for your path. So thank you so much for taking time out of your day today so that you can learn a little bit about what DBT is. And people usually ask me this, and they're constantly asking me, what is the difference between DBT and CBT? And we're going to talk a little bit about that today, and we're going to try to accomplish it in less than 10 minutes. So the main thing here is, even think about, have you ever felt torn, maybe between accepting that you are where you are in life, and at the same time, you want to change something about yourself? And overall, I want to kind of normalize that. That is the human experience. It's not a flaw. It's how we're meant to be. We have that push and the pull, throughout our lives, where we may want to change ourselves while at the same time, we may not want to change. And we might feel like we want to stay in the same place. And really, that's the core of DBT. So DBT stands for Dialectical Behavioral Therapy. And the concept here is that two opposing things that seem like opposites of each other can actually exist at the same time. Now, you know how I feel about this on this channel. You know that I am science-backed, evidence-based. Everything we do at KML has to be rooted in science or anchored in science, because we believe that is the best path to being able to help you get to your optimal self, which is why you're here. So we do believe in doing science-based and evidence-based treatments that actually are going to optimize your ability to get better quicker. And DBT is one of those that is evidence-based. I'll share some studies with you in a little bit to really reinforce this, but it was created a while back by Dr. Marsha Lanahan, and she initially created this to help people that were struggling with something called borderline personality disorder, which is really a emotionally dysregulated state. It's a way of moving through the world, if you will, where people kind of learn to not really regulate their moods all that well, and they're sort of driven by their emotions instead of being able to use their emotions as just information for what's going on within them. So this particular treatment is actually treated to specifically deal with the issues that are the core of that borderline personality. So things like emotional dysregulation, challenges with distress tolerance, issues with interpersonal effectiveness skills, and challenges with really just staying in the moment. A lot of times when we're really, really anxious, we're focused on the future, we're focused on the past, we're focused on really anywhere but this current moment. And that can be normal, but then if it's at an extreme, it can cause some pretty significant problems in our lives. So Dr. Linehan created this, and it's actually been published in multiple studies that it really creates a positive outcome for people that are dealing with emotional dysregulation. So in terms of how you might need something like this, well, in our lives, if you are dealing with, I'll give you kind of the push and the pull. You might have with a person with an eating disorder, they might say something like, I really don't like my body. I'm not feeling good in my body at this point in time. And at this, wanting to change that. And at the same time, I can sit in that and I can nourish my body where it is right now. So that's the acceptance and the change coming together. In terms of our feelings, I will tell you that most of us, kind of just being in the culture that we're in today, we're raised that, if you have quote unquote negative emotion, whether it be anger, sadness, pain, something like that, you must change that. And DBT is actually not so much about that. And really, any good therapist should be helping with that anyway, so that we're not really just jumping to change. We're actually sitting there and saying, well, why might we be feeling this to begin with? And learning actually to kind of sit with and learn to accept that feeling that you're having is information, and probably incredibly important information on where you're at right now and what's going on within you. So if we just ignore it or try to change it, we're actually missing the mark. So I will say too, I noted that DBT is used for borderline personality. So does that mean it's only for that? And the answer is absolutely not. What we know is that those four core things, emotional dysregulation, distress tolerance, challenges with interpersonal effectiveness, meaning your ability to get along with others and interact with others, and challenges with sitting with and being mindful in this moment, are major issues with a lot of different disorders. So since that time of it being evidence-based for just borderline personality, it's now branched out to treating a lot of different disorders. We usually incorporate that into eating disorder treatment, into substance abuse treatment, into PTSD treatment, into severe anxiety or self-harm, or really anything that comes along with emotional dysregulation. And truthfully, even if you are at your most actualized self, I think having a little bit of DBT in our lives could benefit all of us. I will say, in terms of what is the research saying, I'm going to link some of the most recent research down below, but I will say that there have been some recent studies that have shown that people who are dealing with self-harm, specifically teens, that if they learned to do DBT skills effectively, it actually cut down their cutting behavior very significantly. And it even helped to lower some of their suicidal thinking. For people who are dealing with trauma and PTSD, we found that the studies have shown that there's a reduction in flashbacks, dissociation, and emotional shutdown. And those of us that understand DBT can see how that would be, because you're learning to focus on the here and now and to sit with and learning to move through something instead of just trying to shift and change that. We also found that even in short DBT, something as little as 8 weeks, it can make a big difference with actually lasting results. And there are multiple more studies that I just don't have time for in this video. So if this interests you, tell me, we can learn more about it together. Remember, again, never use this as a replacement for your therapy, just as a information and an adjunct to what you're trying to learn to better yourself. And if any of this kind of stands out to you as something you want to know more about, here at KML, we believe in the importance of board certified DBT, and those are the therapists that we use for DBT treatment. So I'll link all of our information down below, and I hope to see you in the next video. Remember, you matter, you deserve, and you're enough.